Hey everyone, welcome back to Learnify. Today we're diving deep into a fascinating topic in human anatomy, the fifth cranial nerve, also known as the trigeminal nerve. This nerve plays a crucial role in our daily lives, affecting our sensations and movements. Let's explore its structure, functions, clinical significance, and more. Anatomy of the trigeminal nerve. The trigeminal nerve, or cranial nerve phi, is one of the largest cranial nerves and is primarily responsible for sensory information from the face and motor functions such as biting and chewing. It has three major branches. 1. Ophthalmic nerve V1. Function. Sensory provides sensations from the forehead, upper eyelids, and nose. 2. Maxillary nerve V2. Function. Sensory serves the middle part of the face, including the cheeks, upper lip, and part of the nasal cavity. 3. Mandibular nerve V3. Function. Sensory and motor provides sensations from the lower part of the face and controls muscles involved in chewing. Functions of the trigeminal nerve. The trigeminal nerve has two main types of functions: sensory and motor. Sensory functions. It transmits sensations such as touch, pain, and temperature from the face to the brain. This is vital for tasks like eating, oral hygiene, and even our emotional expressions. Motor functions. It controls the muscles for mastication, the chewing of food. The muscles involved include the masseter and temporalis, which are essential for moving the jaw. Common disorders affecting the trigeminal nerve. Various conditions can affect the trigeminal nerve, leading to significant discomfort. Some of the most common disorders include 1. Trigeminal neuralgia. This condition is characterized by sudden, severe facial pain that can be triggered by simple activities like eating or talking. 2. Neuropathy. Damage or injury to the trigeminal nerve can result in numbness, tingling, or pain in the facial region. 3. Sinusitis. Inflammation of the sinuses can compress the trigeminal nerve, leading to facial pain and headaches. Diagnostic techniques and treatments. If someone experiences prolonged facial pain or other symptoms related to the trigeminal nerve, it's crucial to seek medical attention. Diagnostic methods may include MRI or CT scans to visualize nerve compression or other structural issues, electrophysical tests to assess the nerve's functionality. Treatment options may include medications, such as anticonvulsants to control pain in trigeminal neuralgia. Surgery. In severe cases, surgical procedures might be necessary to relieve pressure on the nerve. Now we'll be discussing a vital aspect of neurological assessments: how to examine the trigeminal nerve, also known as cranial nerve V. This simple yet essential examination can provide valuable insight into a patient's health. Let's get started. Before diving into the examination, let's quickly recap the anatomy of the trigeminal nerve. It has three main branches: the ophthalmic V1, maxillary V2, and mandibular V3 nerves. Each branch has specific sensory and motor functions, which we will assess during our examination. Setting up the exam. First, ensure that you have a quiet, well-lit area for conducting the examination. It's essential to make the patient feel comfortable, so introduce yourself and explain the process. 1. Gather equipment. You'll need a cotton swab, a pin or safety pin for sharp sensation testing, and possibly a tuning fork. 2. Review. Patient history. Before starting, review any medical history related to facial pain, numbness, or previous neurological issues. Sensory testing. Now, let's move on to sensory testing. This part evaluates the sensory function of all three branches of the trigeminal nerve. 1. Ophthalmic branch, V1. Gently touch the forehead area with a cotton swab. Ask the patient to close their eyes and tell you when they feel the touch. 2. Maxillary branch, V2. Next, assess the cheeks. Use the cotton swab again and ask the patient to indicate when they feel it. 3. Mandibular branch, V3. Finally, touch the jawline and chin area. Confirm the patient's sensation by asking them to say "now" when they feel the stimulus. Example of patient. It's crucial to compare sensations on both sides of the face to check for any asymmetry. Motor function testing. Next, we'll examine the motor function of the mandibular branch. 1. Ask the patient to bite. Instruct the patient to clench their teeth. Observe the prominence of the masseter muscle on both sides. 2. Assess jaw movements. Ask the patient to open their mouth wide. Ensure the jaw is midline. Any deviation could indicate an issue. 3. Resistance test. Place your hand under the patient's chin and ask them to attempt to close their mouth while you provide resistance. This tests the strength of the muscles of mastication. Reflex testing optional. For a more comprehensive examination, you can also assess reflexes. 1. Corneal reflex. Gently touch the cornea with a cotton swab and observe if the patient blinks. This tests the sensory and motor pathways of the trigeminal nerve and facial nerve. 2. Jaw jerk. Reflex. Using a reflex hammer, tap the chin with the mouth slightly open. A normal response is a slight closing of the jaw. After conducting these tests, it's essential to interpret your findings carefully. Any issues with sensation or movement may indicate an underlying neurological condition. Understanding the trigeminal nerve is essential for recognizing its importance in our daily lives. Congratulations! You now know how to perform a thorough examination of the trigeminal nerve. If you found this video helpful, please give it a thumbs up, subscribe for more medical content, and leave your comments or questions below. Until next time, stay curious and keep learning. Thanks for watching. See you in the next video.